Well, it's looking like it's doubling in infection around every 2 to 3 days. So it's very, very significant. Currently, something like 20% of all infections are Omicron, and it's 44% in London. And if that's doubling every day, we know that come the weekend, Omicron will be much more widespread than Delta.
And of course, initially the reports were that it wasn't going to be as serious, the symptoms weren't so bad, but you've just had your first death. So it does seem as if it can be quite serious if it, properly develops.
Yeah, I think we've got to be careful at interpreting this data. Obviously, the information coming from South Africa is that it's a more mild disease. Even people getting into hospital aren't having to be ventilated at the same rate as during the Delta wave in South Africa, but it's very early days. And even if Omicron turns out to be less disease-causing, less dangerous, if you've got such a large number of people infected, then sadly a few people will get sick and will die.
What impact is it having currently on the health system and hospitalisations? Has that flown through yet?
Not yet. No, there are not that many hospitalizations. The big issue at the moment for us is the enormous pressure on the NHS, not only due to the normal winter pressures that we experience in this part of the world at this time, but also the booster campaign. So the so-called supercharged booster campaign, which is aiming to boost 1 million people a day up until the end of this month, is starting to put an enormous strain on the NHS in this country, on primary care as well.
How critical, though, is that booster program to try and contain the spread of Omicron?
I think it's really essential. We've seen from data from South Africa, now we're experiencing it ourselves, that if you've either been infected previously with COVID and or you are double jabbed, you can get reinfected and you can still get poorly. Symptoms, as we said earlier, are mild, but it doesn't stop you getting infected. Whereas all the information we're having now, both from lab studies and from early data that we've generated in the UK, indicate clearly that a booster jab will be significant in protecting from infection and from getting severe disease with Omicron.
Yeah. So what we really are seeing, it is far more infectious, it would seem, than Delta, not as virulent, but still with the potential to really put a lot of strain, which is how many countries have learnt how to live with the virus, so to speak. So how might this change our thinking in terms of being open up and not having the restrictions we've had in the past?
Yeah, I think it's quite clear that there are a lot of lessons to learn from this. One is that the mantra that we've heard all the way through the pandemic is that nobody's safe till all of us are safe. And what this tells us is the more vaccines we can get out across the world, the more we can suppress this virus, the more we'll stop it changing and spreading. So that's really important. I also think that vaccination is really fantastic, but we also have to have other measures in place, not lockdown measures, but other restrictions. And so in the UK, I think in the last few months, people have been rather complacent. And we all felt, I think, perhaps that COVID had gone away. Some of us realised it hadn't, of course, but there's a lot of COVID fatigue. And I think what we need to be doing is making sure some of the restrictions, or I call them protective measures, are put in place. This is more widespread use of face masks. In the run-up to Christmas, just being careful about gatherings, particularly in poorly ventilated spaces. And we do have lateral flow tests. I think lateral flow tests are going to be really important in helping to monitor who's infected and for individuals to isolate if they are infected.
But to your point, those restrictions are being heavily restricted within the government ranks as well. Resisted.
Yeah, they are. I mean, there's a big debate that's going to go on in our parliament today about the COVID passes or passports. This is very controversial. And there is a big debate about the value or otherwise of those. I feel we should be putting a lot more concentration on more widespread use of face masks and indeed spacing. We haven't heard enough about sort of social distancing. The big concern, of course, is that we have a rather mixed message from our government of working from home where we can, where that's possible, but not restricting people in terms of large gatherings at Christmas parties. And this is causing a lot of confusion.
Lawrence, is there anything to suggest in this Omicron variant that while more contagious, potentially less virulent, it might be a signal that the virus is starting to wane, starting to weaken?
That's always been the hope. I mean, the hope from a sort of virological perspective is that as the virus is adapting to us, and what we're seeing here is essentially evolution of the virus in real time, is that it will become more infectious but less harmful. Whether Omicron represents that, I don't know. There is a possibility that if this virus causes less severe disease and we can protect the most vulnerable with booster jabs, then it may be a way out of the pandemic. But I think we just need to keep an eye on how things develop over the coming weeks.
Yes, well, I think from here we're going to be keeping an eye on the UK very closely. Good to talk. Thanks so much.
Thank you.